Good morning, everyone. My e-poster is on review on pulpodentinal regeneration, Boon or Bane. And before I start, I would just like to say that all the diagrams in this e-poster are hand-drawn by me and are just for pictorial representation. So let's delve right in. This e-poster focuses on the regenerative potential of all the stem cells that are present in the tooth structure and how these stem cells help in the regeneration of dental and non-dental tissues. There are ongoing researches which have proven successfully given results where from these very stem cells, non-dental and dental tissues have been regenerated. This poster also highlights the prospect and the futuristic approach that dentistry can uptake in the near future, where stem cells can be used for pulpodentinal regeneration. So stem cells in the tooth. The tooth harbors a number of stem cells in various structures like the pulp, which are the dental pulp stem cells, the apical papilla, also known as scap, the pulp of deciduous teeth, known as shed, the dental follicle, known as dental follicle stem cells, and there are also periodontal stem cells. These stem cells on isolation and culturing have pluripotent potential, and this potential is possibly due to their ectomesodermal origin, which helps them to have the inherent programming factors where they can generate differentiated cells. Now, how will this change dentistry? The current treatment plan focuses on salvaging the pulp, but the concept of regenerating the pulp has added a different dimension to the future of dentistry. Epexogenesis, revascularization, bone augmentation, and pulpless canals can undergo pulpal regeneration. This approach is also in line with the concept of conserving the tooth structure in the best way possible. Here is a diagrammatic representation of various dental stem cells, the one found in the pulp, shed, scap at the apical papilla, and the dental follicle stem cells. And these histological diagrammatic representation shows the various non-dental tissues that they can regenerate. Now let's focus on a few researchers. Dental pulp stem cells can promote differentiation and proliferation of neural cells in the hippocampus of mice. They can form bone when combined with platelet-rich plasma or hydroxyapatite. They can engraft and stimulate angiogenesis and vasculogenesis in model of hyoid ischemia of mice. They can display myogenic potential when injected into dogs with muscular dystrophy. They can generate tooth structure. Now, what is the most effective combination for pulpodental regeneration? There have been many researches, and the best way that pulpodentinal regeneration can occur is through a magic triad. There is a tissue scaffold, growth factors, and dental pulp stem cells, which are isolated. The combination of the three yields the best result, and this is what the researchers say till now. The clinical implication is they can help in bone regeneration, they can help in pulpal regeneration, they can help in revascularization of pulp, they can help correct apical defects, they help in periodontal regeneration, and they also help in the regeneration of the nerves of the pulp. Moving on, this is the methodology, how the process of isolation of the stem cells to culturing them and to producing a differentiated cell is done. So first, there is extraction of the tooth. It could be any tooth, an adult tooth, a deciduous tooth, or a tooth which is unerupted with an intact dental follicle. Now, this is stored in a transport media with penicillin, streptomycin, and 5 mg per ml amphotericin B. Now, there are various methods of stem cell identification, and the appropriate method could be used. Different researchers use different methods. There are methods like fluorescent antibody self-sorting, protein cell markers like CD146 can be used, immunomagnetic bead selection can be done, or immunohistological staining can be done. Now, once the stem cells are identified, the pulp is isolated, it is cut into small sections, and then it undergoes two processes, enzymatic digestion or outgrowth methods, both of which After undergoing these two methods, the pulp cells are then put in cultural medias, and specific cultural medias give rise to specific differentiated cells, after which they are cryopreserved and they undergo magnetic freezing. And then these cells can be used for clinical trials. Once the clinical trials are successful, the combination of growth factor, dental pulp cells, and tissue scaffold can be used for successful pulpal regeneration. Now let's move on to the advantages and disadvantages of these methods. The advantages are they preserve the natural tooth structure. They are minimally invasive. When autologous stem cells are used for implantation, they reduce host immune cell rejection. Using the stem cells for regeneration of future non-dental tissue generation can also be done. And these advantages have a great prospect of using this technique in the future. Now, limitation. Firstly, appropriate cell markers are needed, and researches are still going on are the exact cell markers that we can use. The sourcing of the stem cells is a big limitation. There is no medium that enables the stem cells into directly differentiate into tooth germ cells. You can create differentiated cells of the pulp, but the germ cell is still, there is no medium that enables us to recreate the tooth germ cells. There is concern over host rejection, and one of the biggest concern is tooth banking and the awareness of this whole process. Now for conclusion, tooth rebirth. The possibility surrounding the effective regeneration of dental and non-dental tissue is of mammoth proportion. And there has been substantial success in this field, and the prospect of changing the future of dentistry underlies with this process. On the contrary, there are limitations that need to be prioritized, optimized, and integrated in order to develop this technology successfully. Here is a case study that is done by my guide, which shows the before and after radiographs where there has been successful closing of the apex with a scaffold material. And this helps in regeneration of pulpodentinal structures. Here are the references. Thank you for your time.